We chose Vizient because of the overall value that they brought to the table. Beyond the GPO, there were many clinical programs, there were the affinity groups, the purchasing coalitions, the concentration on quality and outcomes, which frankly a lot of the other GPOs did not offer. And I would say that one brilliant connection that stands out is our having an embedded, dedicated resource at the hospital that would help us achieve our objectives and bridge Vizient and the hospital to make little problems and barriers stay small and to deliver optimal results in basically the shortest period of time. When one looks at the value that the networks provided, I have to say it was mostly on the pricing side of the equation. On the Med-Surg side, the Mid-Atlantic Purchasing Coalition probably brought us several $100,000 a year in savings. But the real payoff, and unexpected to some degree, was the results that we received on the pharmacy side, where we saved well over $1 million a year. Now, in addition to that, the network through the Mid-Atlantic region also negotiated a pharmaceutical distribution agreement, which brought us an additional benefit of over $1 million a year. And now we are part of Accelerate, where already just concentrating on the cardiac side of our business, we've exceeded $1 million in savings. So when you talk about value, there's a lot of value that Vizient provided. If I were to summarize the differentiating features that Vizient brings to the table, I would say that it's much more than a group purchasing organization. There's a concentration on clinical outcomes, there's significant networking opportunities, and the people on my staff to be part of an organization and conferences, seminars that give them exposure to what's happening in the rest of the industry, so that they're not just sitting at Valley Hospital thinking only in terms of Valley Hospital. So the external view and the education that Vizient brings to us is very important.